Hello, MP Mark Warawa here from Langley Aldergrove, and I'm in Ottawa with Dr. Catherine Ferreira, and she is a physician, practicing physician in the province of Quebec.
That's right.
And Catherine, you were one of I was hoping one of the witnesses that would have come to the special joint committee on the issue of euthanasia and assisted suicide. Unfortunately, you were not called to be a witness, but what you have to share is very important. Canadians need to hear, and if you would have been called, maybe the report from that committee would have been quite different. But what are your concerns with the direction that the government is going and from this report?
I practice medicine in Montreal. I'm the president of the Physicians Alliance Against Euthanasia, which is a Quebec-based doctors group that's been trying to stop what's been happening. I have two main concerns. One is freedom of conscience of physicians and all healthcare professionals, and the other is patient safety. And you need the freedom of conscience to ensure the patient's safety. So that means we should be allowed to not euthanize patients, not kill patients, not refer them to be killed. There's no difference ethically between killing somebody and sending them to someone else to do it, even if it's through a medical administrator, as is the law currently in Quebec. So that's essential. If we don't do that, we're living in a totalitarian country. Patient safety, consent is a difficult issue. Vulnerable people are a difficult issue. We have to make sure that people are not asking for death because they're alone, because they're in pain, because they feel they're a burden on someone, because there are things that we could have done for them that we're not doing. Access to care is a huge problem. All of a sudden we're worried about access to death, but what we need to worry about is access to care. There's a new initiative that came out last week called the Vulnerable Person Standard. Came out of the disability community for the most part, and they are asking for prior authorization. So a judge or a juridical body would authorize the euthanasia before it happens. There's no use checking after, the patient's dead already. They're also asking for a vulnerability assessment. That means that an interdisciplinary medical team would look at all of the issues surrounding that patient and what can we do to help them to prefer to live than to die before anybody goes ahead with offering them death. The same thing about consent, making sure they really have an irreversible condition that cannot be alleviated and that they know exactly what they're doing. There's no pressure from anyone. Most medical decisions are made based on all kinds of factors, including outside influence, whether it's on purpose or just indirect, but there's always something there, and this is death we're talking about.
So, Doctor, you said it was easier to get death than good quality health care.
Well, certainly reading the Joint Committee report, it was all about access to death for children, for psychiatric patients, for people with psychological suffering, with advanced directives, so you could sign now to get killed later if you lose your memory. But what about access to health care? That's the big problem. They just cut all the geriatric beds in my hospital. There are huge, huge problems of access.
Well, thank you for your passion and for committing to protect the vulnerable, and hopefully Parliament will listen to you. And I think you represent where Canadians are, and I'm not sure why the special committee has gone so far from what the Supreme Court said in the Carter decision, but let's hope that common sense prevails in Parliament. Thank you for your good work and standing up for life.
Thank you. It's a pleasure.